As Children's Minister, I've worked to ensure that the health, safety and well-being of children and young people in Jersey have been our top priority during these 6 months. During the coronavirus pandemic, we launched the Children and Families Hub to provide extra support to families, and in the first 3 months the hub received referrals relating to 750 children. This service was a resource to provide information, advice, guidance and, where required, direct support to those children and families needing early help to offset the challenges posed by the prolonged absence from care and school and nurseries. To maximise the impact of the hub, we launched a cross-government campaign asking the community to be the eyes and ears of the vulnerable and to report health, well-being and safeguarding concerns. To best ensure the health, safety, well-being and learning outcomes of our children and young people during the initial pandemic response, we established a COVID-19 vulnerable children list with every identified vulnerable child having a lead agency and lead worker. We set up a temporary 24/7 child and adolescent mental health service inpatient unit for the children and young people who would have usually been managed in either the Jersey General Hospital or off-island. As well as thousands of contacts being made with young people and their families by the professionals working across sites, a large-scale survey of the experiences of children and young people was jointly commissioned with the Office of the Children's Commissioner, and we're extremely grateful to the 2,105 children and young people in Jersey who shared their thoughts and feelings about the pandemic in this survey.
In education, we faced huge challenges, like many across the world, in delivering quality education to children and young people during the pandemic. Schools were closed in March to curb the spread of COVID-19, and our priority focused on the health, safety, well-being and learning of our students. During this time, we were able to reopen schools to some of the island's most vulnerable children and those of our critical workers. Staff, parents and carers worked together to provide a coherent curriculum at home and for those as mentioned in schools. As the situation evolved, we were able to reopen successfully following strict safety policies before the end of the academic year with our Safe Return to School campaign. The Jersey Youth Service adapted quickly to ensure that the clear demand for a greater wellbeing service was provided through enhanced counselling and street-level youth work. To ensure the health, safety, wellbeing and learning of students during the initial pandemic response, we supported schools to protect students through the Psychology and Wellbeing Service, proactively making hundreds of calls to families to ensure that they were managing. A recovery curriculum was put in place. Wellbeing was paramount in this, with schools welcoming children back, making them feel safe and valued, re-establishing friendships and helping them learn new ways to behave, as we've all had to. Higher education students have also been supported by the student finance team, from logistical support to retrieving belongings left in the UK, with help from partner agencies like Jersey Post, to additional financial support for final year students, allowing them to return to university in the autumn term, and by Skills Jersey to access online university resources. Additional support is being put in place for children and young people to address the loss of in-school learning during the pandemic. Most of this work will take place in the new academic year starting in September.